Good morning, everybody, and welcome to you all for this virtual meeting of the Bournemouth, Christchurch and Poole Health and Wellbeing Board. Could I start by taking the opportunity of welcoming Mark House, who is the Area Manager of Dorset and Wiltshire Fire and Rescue Service, who's replacing Seth Wise, the services representative on the board. And could we also take the opportunity to thank Seth for all his support. We are also welcoming Alistair Doxett-Purser, who's the chair of the Access to Food Partnership, who will be attending for item 6. Just a note, if I may, to let you know that while we're not live streaming the meeting today, as there's a planning committee meeting, which is now starting earlier and running at the same time as this board. The live stream is therefore being used for the planning committee, but we will record this board meeting. So if anybody's tuning in later, this was a meeting that took place earlier today on Thursday via Microsoft Teams. Following the meeting, we'll then publish on the website. And again, just to highlight that any member of the board with their camera on will be picked up by the recording. So moving on to the agenda, we'll start with apologies, if I may, and I'll ask the Democratic Services Officer to report on the apologies and item 2, which is substitute members.
Right. Many thanks, Chairman, and many thanks for sort of outlining the arrangements for recording of our meeting this morning. If I can just highlight that normal arrangements apply for the purposes of our virtual meeting. So if you do want to speak, use the raise your hand option. When you are speaking, if you can unmute and have your video on. So moving on to the apologies that we've received. I have apologies from Chief Executive BCP Council Graham Farrant, our Corporate Director for Children's Elaine Redding, the Chief Constable, Councillor Bobby Dove as the BCP lead, but can I take the opportunity of reporting that Councillor Jane Kelly is here to replace her for this meeting. I also have apologies from Simon Watkins and from Sean Thomas. If there are any others that I have missed, please let me know.
No, nothing coming forward. Thank you, Karen. So moving on to agenda item 3, declarations of interests. And I could I ask please whether board members have any disclosable pecuniary interests that they would wish to declare, or indeed local interest in respect of the issues before the board today. I'll take that as none. Agenda item 4, public issues, and there are none. Before we move on to agenda item 5, which is the confirmation of the minutes, I wonder whether for anybody who, particularly for Mark, who is very welcome as a new member of the board, or anybody watching, we might very quickly whiz round and do introductions. If you will forgive me, I will just call names and ask you to say who you are. So it may sound very much like a school register, and it is done simply in the order in which people appear on my chat bar. So I'm Councillor Nicola Green. I'm the Cabinet Member at BCP for COVID Resilience, Public Health and Education, and I'm the Chair of this board. The Vice Chair, Tim.
Hi everyone, I'm Tim Goodson. I'm the Chief Officer for Dorset CCG.
Alistair, you're already here? No, maybe expecting Alistair later. Perhaps he and Amy could introduce themselves at the beginning of the next item.
Apologies, Chair. I was trying to get my mute to turn off. Yes, Alistair Doxett-Purser. I'm the Chief Executive of FaithWorks and I chair the Access to Food Partnership.
Thank you. Amy.
Hi, yeah, Amy Gallagher, Community Partnerships Officer at BCP Council and working with Alistair on the Access to Food work.
Jane Kelly.
Thank you, Chair. Yes, Jane Kelly. I'm the lead member for community engagement. I'm subbing for Bobby today.
Mike White.
There's Mike White, lead member for Children's Services. Thank you.
And if I could just interject at this point, Councillor Karen Rampton will be joining us, but she'll be joining us a bit later. She has a prior meeting. Debbie Fleming.
Good morning, everyone. So Debbie Fleming, Chief Executive for University Hospitals Dorset. Good to be with you this morning, and apologies, I was a little late. They held me back in another meeting.
You're very welcome. Jan.
Good morning, everyone. I'm Jan Thurgood and I'm Corporate Director for Adult Social Care for BCP Council.
Joe Tyler. Oh, Joe's just popped off. Karen Loftus.
Hello, good morning, everyone. Karen Loftus, Chief Executive of Community Action Network.
Karen Tompkins.
Good morning, everybody. I'm Karen Tompkins. I'm the Deputy Head of Democratic Services and I'm your normal support for the board.
Kate.
Kate Ryan, Corporate Director for Environment and Communities at BCP Council.
Louise.
Good morning, I'm Louise, I'm the Manager at Healthwatch Dorset. Nice to meet you, Mark.
And Mark.
Very nice to meet everyone. Thank you very much for such a lovely welcome. It's great to meet you and I'm looking forward to working really closely with you and everyone's teams, so thank you.
Michelle.
Hi everybody, I'm Michelle Smith from Public Health Dorset, working alongside Alistair and Amy in the Access to Food Partnership, sharing the report today.
Paul.
Morning everyone, Paul Iggulden, consultant in the Public Health Dorset team.
Richard.
Good morning, I'm Richard Jenkinson. I'm a GP in Christchurch and Clinical Director of the Christchurch Primary Care Network.
Sally.
Good morning, Sally Sancraft. I'm Director of Primary and Community Care in Dorset CCG.
Thank you. And last but very much not least, Eugene. You're muted, Eugene.
Take two. Morning, everyone. Eugene
Morning.
Kelly, Chief Executive of Dorset Healthcare.
Thank you very much and welcome everybody. We'll move on to agenda item 5. Sam, did I miss you? Sorry, apologies.
Morning, everybody.
I'm so sorry. I was scooting past.
That's okay. Public Health Dorset and BCP Councils.
Thank you. Apologies. So agenda item 5, we have the confirmation of the minutes and the action sheet. Do we agree to confirm the minutes of the board, which was held, goodness, 3rd of December last year? Does anybody wish to bring anything up or dissent from that, or are we happy for that to be agreed? I'm seeing no dissent, so we'll move on. And do members have any comments on the action sheet? And seeing nothing, no hands, and therefore recording no dissent from that. Thank you. Now we move on to the first item of significant business today, which is agenda item 6, under the title of Eliminating Food Insecurity. And this is an update from the Access to Food Partnership. And this is a triple act between Amy Gallagher, Michelle Smith and Alistair Doxett Purser, who are going to be presenting the item. I don't know how they're going to be up for the challenge of encapsulating the amount of work and commitment and partnership that's gone on with this, the Access to Food Partnership in such a short time. So it's going to be necessarily a whistle-stop tour, and that's what we've asked them for. But I'm sure they're going to raise some highlights and pose some challenges back to the board. And just ahead of that, I wonder if I could just ask board members to be mindful of the recommendations that we'll be considering, and that's to agree an approach on how to engage and support the work of the partnership, and I'm sure that will be talked through, to allocate a champion to help drive forward change, and to invite the Access to Food Partnership to report back to us at least every 6 months. So over to the three of you, and then we'll hope we'll have many questions.
Thank you so much, Chair. If I could start, what a great opportunity to meet with you. We really appreciate that. Amy's going to be sharing some of the slides and doing the clicking to make sure all the technology works really well. We've just got a few slides to go through with you, but as I say, Amy Gallagher is here from the BCP Council Communities team and Michelle Smith from the Public Health Dorset team, and we're really grateful for also Daisy Carr, who is the BCP Council Communities Food Network Coordinator, for huge amounts of work that she has done to help with this process over the last year. That post has been really fundamental in all that we've been able to do. So again, we hugely welcome this opportunity to talk with you, and thank you so much for your interest and desire to really see breakthroughs in this area. You have with you already in the paperwork a summary report, which also has a summary of all the activities that have gone on in year one, as we called it, together with an outline action plan for the coming year. So I'm not going to go into a lot of detail on that. Our goal this morning, if it is okay, is to just give you some headlines in terms of the journey we've been on so far, and then to pick out 5 areas where we would really welcome your support for this programme, and indeed to work with you on eliminating food insecurity. So Amy, if I could ask that you flick onto the next slide. Our aim here is to try and talk for less than 10 minutes and then see if we can leave plenty of time for questions. Just to talk you through the journey so far, we have in 2019, there was the Dorset Hidden Hunger Conference sponsored by the Sustainable Food City Network and Public Health Dorset. We're really grateful for that. One of the key findings that went into that was that if you take that inverted triangle, which you can see there, which was trying to state the different levels of food insecurity, then 46% of people within Dorset were not spending enough to eat a healthy diet, and specifically 27%, so over a quarter of people were either in food crisis or unable to afford healthy food, which is one of those things that needs a moment to sink in, that over a quarter of our population are in that sort of situation. Our goal, therefore, security, and on the back of that, we're going to see the other 19% together who may not have the ability to cook or are prioritizing other things will also benefit as well. So this is really key work for ourselves in this area. In 2020, clearly there was a massive upscale of need as the COVID pandemic hit, and there was some fantastic grassroots creativity that came to bear on that. Just to give you a few examples, organisations in Christchurch came together and actually got a way of cooking 150 hot meals a week to go out to those in most need within their area. Food banks developed a whole range of other options, including kitchen equipment, so that people could actually cook as well as have the food that they need. New community pantries were set up in Poole and in Turlingmoor. More food has now become a real staple of the local Turlingmoor community. Allotments were linked in with food settings. Schools were linked in with food settings. There was a WhatsApp group that was sharing excess food, so none of it was going to waste. There was a lot of innovative ways of thinking. And that led us on to then the third element on the page, the access to food map, which you can see has had over 6,500 hits now from now it's been made open to the general public. But it underlines the fact that it was an issue in 2019. It was clearly exacerbated in 2020, and it is still an issue that there are people within our areas who do not have enough food, or cannot cook that food, or don't have the confidence to cook that food. So that's where the Access to Food Partnership is really timely in trying to bring this together. If we can move on then, Amy, to the first of the areas we would like your support and leadership in. First of all is championing the issue. One of the things that we've sought to say, this isn't just about getting emergency food to people, as the vision of the partnership says. This is about a Bournemouth, Christchurch and Poole where everyone is able to feed themselves and their family nutritious food all of the time, and it's setting that bar quite high. We don't want to keep on just sticking plasters onto the situation. We want to get to the point where everyone can afford food, have equipment, have the skills, have the confidence. That's a big, hairy, audacious goal, but I hope that between us we can share that goal in different areas that we can influence. Part of that will be about sharing language that we can use across the whole of all our sectors, and getting behind some of the stereotypes and the myths that may have been there in the past. From our side, we've been working really hard to change the understanding that food banks are not just about 3 parcels over 6 months, but actually working with people through their journey to get out of food crisis. Also thinking about the fact of how we can share intelligence to enable us to be really targeted. And when we say the passes the so what test, it's really easy for us to say, oh, look, we've done this many emergency parcels or this many Christmas hampers, and that is fantastic and should be celebrated. But actually, we want to get underneath that and say, OK, if we look at the access to food map and we compare it with insight data from our public health colleagues, or from we have links with University of Southampton or the council's insight team to understand if there are particular areas or particular cohorts of people who, for some reason or another, are not being able to access the food that they need and then cook it and have the confidence in that area. So it'd be great to be able to share intelligence to enable that targeting. And indeed, we would love for Health and Wellbeing Board members to be leading the systems change. It's nationally, there are obviously some big initiatives last year. Marcus Rashford effect is the shorthand for that. But where we need to see systems change, it is so good to be able to work with you in this area. So there's one area about championing the issue in itself. And then Amy, if we can link onto the next one, there are some clear pathways that it would be good to really make sure we have joined up. One of the things we've talked about is, as we say, fast out. There are new people who are struggling now to find enough food because they may have lost jobs or on the point of being made redundant. We want to make sure that they only are in crisis for the shortest possible time. What is the way that we can make sure that they are back on their feet, able to support themselves? And there are many, that might mean linking in with a local food setting, a community fridge or something like that. It might be just linking in with a community group. There might be a whole range of things, but finding a pathway that we all understand. Similarly, a recovery pathway for those who are on a longer term journey and who may be maybe further away from being able to afford or to have the equipment or the confidence to cook, then having those pathways right across the integrated care support network. So we're really grateful on the steering group to have Gay Wright working with us from Children and Young People Services. It's great to have Stephanie and Donna from the Adult Social Care Crisis Team, and that's been a crucial support. And we'll come on to the fact that it might be good to have other colleagues from other parts of the system, if you like, on that steering group to make sure we're all linked in and integrated. We hugely support the ABCD asset-based community development work that is being proposed and driven forward by the council, because we think there are some fantastic examples that are already happening out there in terms of communities and grassroots teams using their assets and their strengths to the best. So we would hugely support that, and we would love to be able to share some of the existing ways that that's working really well. And we'd also like to build on the excellent models with yourselves, learning of how this can work. We had some really helpful input from the social prescribing teams within the GP surgeries and being able to make that link with food. So it's not just about isolation, but it could be about making sure that people are connected into a food setting. So it means that's never going to be an issue for them. The cook bags models, some of you may have come across from our friends at the Friendly Food Club. Very simple idea of the ingredients plus a recipe plus a video of how to make that food. That's been hugely successful within lone parent communities and also linking in with schools as well. And we'd love to see those develop and grow. And there may be other ideas and models from your areas that we should be using and enhancing. If I can go on to the next slide, Amy. So that obviously leads us to say we want to help people get out of crisis quickly, but we also want to prevent crisis. And so there are many listening approaches that are going on right now. We've started a broad listening activity within the partnership, the Access to Food Partnership, but there are other ones that it would be good to link into to make sure we're on the same page. There's you can see a couple of them there, so that we can really start to understand where there might still be hidden hunger across our area. And commit clearly joining up comms campaigns, communications campaigns, and just having within our minds that there are aspects of, for example, financial resilience that will have a knock-on effect to people not being able to afford the food that they need to support their families. So if we can join up those prevention agendas, that would be great. And indeed, encouraging those broader discussions. It's great to see the business community so involved in some of the homelessness work and seeking to also some people bringing forward food options, either the excess they had during the pandemic or indeed just wanting to go on and provide really innovative ways of thinking. How can we integrate them more into the discussions that we're having? Then the next section is about capacity building. To really make sure that this is sustainable, we would love to have broader membership on the partnership. So colleagues from the CCG, police, Dorset Healthcare, maybe other teams in some way integrated within either the steering group or the forum that we have, or finding other ways that would be effective for you. creative resourcing the partnership is going to be really important. We are so grateful, as we say, to Daisy Carr as the food coordinator over the last year. Her post is for 2 years. We don't want to run into a brick wall at the end of this financial year, this coming financial year. So that's one of the areas where we're looking for creative ideas around resourcing that. And so many partners are using what we might be termed generous partnership leadership. To actually give some time into this because they recognise the importance of it. We've also seen that the funding multipliers that we were able to do through the Dorset Community Fund from the Winter Fund grant was hugely helpful in providing creative ways to make sure that people were being able to feed their families. And the numbers, a recent press release on some of that you may have seen. So all of that capacity building, we would ask again that the Health and Wellbeing Board would support us in. And then finally, as we said, it would be really easy for all of this amazing work that's been going on over the last year, and for when the subject has been so much in people's minds, for us to lose the momentum and lose the focus as the world opens up again, if I can use that terminology. And we would really ask, and we welcome so much the opportunity to work with you to keep that in as a focus, because we believe that it really shouldn't be 27% of people in our area not being able to feed themselves and their families effectively. So that's partly about whether there are inspirational messaging that you can use within your own context. And it may be about us owning up to the fact some of us, I'll put my own up, some of us are not great with our own cooking skills, and maybe learning and using cook bags or something like that as a way to show that we're on with this as well. But one of the ways that we can do that is obviously working with yourselves and coming back to you. And we would be asking whether we could have a champion on the Health and Wellbeing Board from the Access to Food Partnership. We will be seeking to come back to you every 6 months to report on progress, as we noted within the action plan. And we will be seeking your help where there may be major barriers to pushing this forward. If I can just finish with a little story that we had from one of the food banks. This could be from another food setting, of a guy who came at the start of the pandemic and came to the food setting and said he'd just been chucked out of his family home because of various issues. Through the course of the year, not only was that food setting able to give him food, but they helped him to get into some accommodation of his own. They also then enabled him he had a real love for bikes. So they gave him a bike that had been left to them, and he was travelling around town sorting things out. He got to the point where he was really interested in this. So there was an opening at a local bike shop for a volunteer. He went along to help at that bike shop repairing people's bikes. He's now got a full-time job there. And for the last couple of months, he's been Employee of the Week. He now comes back to the food setting to say, you're my family. You are the community who have supported me. And I want to keep coming back and supporting you now that I am out of my own crisis. That's the sort of story that really keeps encouraging us to keep going with this. So Amy and Michelle may have a couple of points to bring in, Chair, but otherwise we leave you with these points for discussion.
Alistair, thank you very much for just covering the ground so skillfully, giving us more than a taster of what this is about. But I think the passion and the energy of everybody involved has come through you. So thank you for that. Amy, Michelle, is there anything you'd like to add, or would you just prefer to be available to respond to questions should they be necessary?
No, I think Alistair's conveyed what we were wanting to discuss. I think I'll stop sharing my screen just to facilitate a bit more discussion, if that's okay, unless people need these points up on screen.
We might perhaps want to go back to them, but yes, that's a good idea, Amy, as you suggest. And to be very clear, in working towards the presentation for today, that I'm conscious that you and Michelle have been very much engaged in preparing this document that's come forward to us. So thank you both for that. What I would like to do, if it's okay with members of the board, is to bring in Councillor Jane Kelly, who is the portfolio holder for engagement, but who is our ABCD champion, and I will let Jane talk more to that. So, a group of letters we're becoming to understand, but I think Jane could set it out very well and where these things fit together.
Thank you very much, Councillor Green. Yes, this is absolutely brilliant. As I was listening to Alice's presentation, it is just absolutely all about how we want to work with ABCD, asset-based community development. For anyone, I'm sure in this forum everyone's heard of it and will be exponents of it. And can I just say that Alice's story about the chap with the bike is so completely on there, because it's all about looking for what's strong, not what's wrong, for facilitating someone and a whole community, but in this case one person, to change their lives completely by given one step up and then making that happen for them completely in their lives. And not only that, but then spreading that word and giving confidence to others. And that's the key of it, really, is to build up community resilience by working with them, finding out what is strong and building on that, and not focusing on the things that are wrong. So, and the way that the Access to Food programme has worked is really also about that, because when you were talking about moving forward, this isn't just an emergency response. This is absolutely about building that capability, confidence and capacity in people right across all our communities so that they can move forward in a better way and being able to help themselves better, to understand how food can be less expensive than they thought it always had been, and to you know, and then that carries on to their children. They become working in that way as well. So we here are really keen on working with ABCD right across the council, and actually in terms of food provision and more healthy lifestyles, that's a really good angle of it, because we had a seminar the other night. We were looking at the way that building works across and development, and allowing communities to really have a say in what happens in their areas. So this has given another dimension, and there'll be many more. So I'm really looking forward to working across the council in the future to bring this further forward. Thank you, Tim.
Thank you, Jane, very much for that. I'd be very happy to open this up for questions and discussion from board members and comments. I think, Tim, I've seen your hand, which is encouraging because it means that the hand function is working. So would you like to go ahead?
Yeah, thanks. I mean, just echoing some of those comments, you know, it was great to see that and hear some of those sort of stories you put across there. I mean, if we're going to get the, you know, almost the basics right in terms of sort of healthier living and the whole health and wellbeing agenda, then it's going to start with effectively the very basics, isn't it? Which is, you know, food, nutrition and everything. So, you know, this is a fundamental building block. So great to see that. And equally great to hear the effectively, you know, the safety net you provided then turns into a springboard for somebody to go on and, you know, do all sorts of other things then in terms of employment. So, you know, really encouraging to hear that. I was just going to make an offer actually that we pull together our sort of GPs to sort of effective membership meeting where every practice in Dorset is represented. If you wanted to come and do, you know, that similar presentation to them to make sure everyone's you know, is aware of that and put some names to faces, very happy to arrange that. And it's the one place you can talk to all the practices in one go. So if you want to make contact on that, happy to do that. Apart from that, really like the presentation, the paper, and keep it all up.
Thank you. Chair, we would really welcome that, Tim. Thank you so much. We'll make contact.
Sally.
Thank you. Yes, echo those comments, and I was pleased to hear about the connections that you've made with the social prescribers that are working within the primary care networks. I think that's a really good sort of key point of contact in terms of making sure that awareness is raised within the networks, but also how those social prescribers know how to access the assets in terms of supporting people that they come into contact with. So I would encourage that continued engagement with those individuals, because I think that will help build capacity and the connection with networks on an ongoing basis. But as I say, any more that you think that we can do to help that, we have got somebody in my team called Karen Stratford who tends to to work with our engagement team around the community and voluntary sector engagement. But also I was making the link as you were talking through around the work that we're doing collectively around inequalities and how we really raise the profile of the work that you're doing in our inequalities work, which is having an increase in focus, both in terms of the ICS, but also at network level as well. So a good opportunity there, I think.
That's great, Sally. Thank you, Debbie.
Thank you. So that was a really lovely presentation, and it's always great, isn't it, when you've got people with passion, and that really comes over from the whole presentation and the paper. So I was thinking about, obviously there's masses of linkages in so many areas out in the community. I was thinking about what the hospitals might be able to offer, and I don't know whether you've got any links already directly within the hospitals, but the areas that it occurred to me as I was just, I haven't been involved closely with the programme at all, or not had a presentation on it before, but I was thinking a bit about obviously what might turn up in our accident departments because of some of these food challenges, and in some of our specialist gastroenterology services or dietetic services. But it also occurred to me, we have a very large catering department that probably there's quite a lot of links and connections there, and our approach on buying locally and what we do with food waste and all sorts of things, and also we employ 9,500 staff, and those staff have got friends and families as well. And so in the area, there will be people who are challenged that might not be on my radar. So I think that was just in my 5 minutes of trying to find something relevant to say and contribute at the end of the presentation. So my thought would be is that it'd be really helpful if somebody within the team, if you've already got a contact in our hospital, let me know, and I will encourage and champion that work. But equally, if you haven't got a contact, then I'd be delighted to make an introduction and just think about where there might be some opportunities to do things even better together. Yeah.
If I may, I think we'll take the questions and comments from the board member, and perhaps Amy and Michelle, you might want to respond to the collection at the end, and Alistair, I'm sure you will. And Debbie, it just occurred to me, and thank you for just jumping in and those amazing things off the top of your head. But there's also potentially an issue around discharges. I'm thinking of people being discharged into the home, perhaps without, for whatever reason they've come in. It's maybe quite a good time to make a contact as well, and to find those vulnerabilities that might not be picked up elsewhere. Apologies, I've slightly lost the order, but Sam, I think you were next.
Thank you, Chair. I just wanted to say thank you really to the partnership, because I've not been very closely connected to this work for sort of fairly obvious reasons over the past year. But I was reflecting on how it started, and to be honest, in public health, we quite often talk about obesity. We're much less used to thinking of food as a structural issue, which is strange, isn't it? Because it's such a fundamental part of everyday life. And I've got to be totally honest, when this started as an idea in the public health team, it was Chris Skelly and a couple of other members of the team said, we want to do a local piece of analysis based on a national report, which I think was the Food Foundation originally, looking at the extent of hidden hunger in the population. They turned up some big numbers. So it was a starting point for thinking about this issue very, very differently. Other board members, I think, have said it much better than me, but the link between tackling inequality, but also that point about asset-based community development is really, really important, because there's a risk that sometimes it is a bit of a theoretical concept. It's something that we might talk about in something like a health and wellbeing board, but this is a very, very real example of how you can pull on the power of people to genuinely make a difference. And the point of that is ownership, isn't it? It's recognition and ownership. And being able to feel as if you can contribute. So I just play testament to the work. I think it's moved on hugely, and I'd be more than happy to take up that challenge that I think I heard today for more vocal leadership on the issue. It's probably something that maybe we don't talk about very obviously, but I'll be very happy to contribute to that and to continue to raise the issue locally. Thank you very much.
Thank you, Sam. Paul.
Thank you, Chair, and thank you, colleagues Alistair and Michelle and Amy, for a fantastic presentation. It was really great. Thank you. Very, in some ways, a very uplifting response to a very poignant issue, societal issue. I was in conversation with colleagues at Dorset County Hospital recently who had, I think, linked up with a local food bank with a view to having a collection point in the hospital. And I thought, what a nice, powerful thing for an organisation to do. There's the basics of helping to gather food that could then be redistributed, but also the sort of poignancy of keeping that to the fore of people's minds. And raising awareness and helping others to contribute in a small way. So I wondered whether it would be useful to the partnership to have other organisations locally making a similar offer.
Great, thank you, Paul. Jan, you've got your hand up, so I'll come to you next. What I would like to do, and I don't want to put you on the spot if there's nothing to add, but both Eugene and Mark, in your very different organisations, you are very much in touch with large numbers of our residents. And Mark, I know the fire service are very, very strong in other realms of prevention. And so after Jan, I don't know whether either of you two would like to contribute, but I won't put you on the spot if there's nothing to add, but please do consider that offer. So we'll start with Jan.
Thank you, Chairman. I just wanted to pick up a couple of issues in my own area in terms of adult social care. Really good to see you're involved with the crisis service, which is a really key point. But it may be that you might want to come to our broader management team, if you haven't done, to have a conversation about all the connection points, Home First being one, but all the connection points in terms of adult social care. Conscious it may not be only older people, there may be other groups of people with whom we're working that we need to be thinking about the connections. So very happy to arrange that. And I just wanted to take up the mantle that the chair was just talking about you raised with the council a number of other areas that you'd like to engage with. So just to give you the opportunity to say what they are, and then those of us on the council will need to go and discuss with colleagues those specific teams. So just wanted to give you the opportunity to come back and say where in the council absolutely would you like connections, so those of us can make those connections for you.
Thank you, Jan. Mark, thank you for putting your hand up.
Yes, thank you, Chair. I think there's some real synergy here, probably between all of the different agencies, actually, and it's such an important issue. It really is. One of our key priorities is about making safer and healthier choices, and we have an extensive network of safe and well advisors who go into people's homes. They discuss issues around particularly fire safety, of course, but actually we're looking at the wider health agenda as well, and a wide range of issues where, if we can't provide the advice, then we can signpost people to the right place. And I mean, as an example, the last full reporting year, we did almost 12,500 visits into the homes of vulnerable people. And there's such an overlap that I think there's a real opportunity. And if it's possible, I would really welcome some input into our teams to raise the awareness. And I think the cycle of help and assistance and communication between us as leaders, I think, will be really positive. Thank you.
That's really welcome. Thank you very much, Mark. Amy, Michelle, Alistair, probably in that order, if I may, will give you the opportunity to respond. I can see you've all been nodding, you've all been making notes, and I hope that's, and you've all been smiling as well. So I think there's some terrific responses that have been brought forward today. So, you know, anything else you'd like to add, and then we'll go back to Eugene before Alistair. So Amy, would you like to comment?
Oh, thank you. Yeah, I just seen that Eugene's put his hand up. I'm not sure if he needed to.
You want to, if you're happy to wait, then it'll probably be. Eugene, would you?
Thank you, Chair. It wasn't the threat of speaking, but my IT gave up, so I'm on the phone. Apologies for that. I think I would echo what colleagues have said before, and what strikes me in this is the real opportunity around life skills, particularly where we are working with looked after children or very vulnerable people within the communities. And Paul's suggestion around how we might be able to contribute to just the whole idea of being more conscious and sustainable about collecting food and supporting our communities. And I think there's a real role for our community hospitals and community centres right across Dorset to be able to support with this. I also think there is something that we should and could be doing more in terms of colleagues who are working within our organisations and the real opportunity around making every contact count, because like Debbie says, they've got family, they've got friends, but actually we're coming across and into contact with a number of people who just raising awareness of this may well be part and parcel of what we do. So that people at least know that the scheme exists and how they can get in touch and be involved in it.
Brilliant. Thank you very much for that. Amy, over to you now.
Thank you. Massive thank you to everybody on the board for your encouragement and really positive feedback and willingness to get involved in the project and the partnership work. So a massive thank you. Yeah, I think it is just being able to connect across the system. Yeah, we do have a number of connections through the Access to Food Partnership and other partnership working that Michelle and I and Alistair do as well. But it's just being able to do that through you at a kind of strategic leadership perspective, whereas perhaps we're working at sort of different levels to where you're working in terms of how we're engaging. And it's just being able to really broaden the relationships and the conversations that happen there and being able to navigate what's available to us and you know, there is a few board mentions and teams here. Those things are really important for us to, if we can do presentations and things like that, would be really, really useful. So thank you for those opportunities. I probably don't want to go into lots of detail on all of them at the moment and would love to be able to kind of follow up with people. But yeah, we and Michelle, you'll probably sort of dip into sort of the hospital in terms of we've done some work with through Dorset Hidden Hunger and those kind of things. But sort of Jan talking about adult social care. It's just trying to link it much more broadly about the work around social workers and everybody that's frontline staff. So we've been doing a lot of training around our map and trying to raise awareness about community food options that are open there. But just continuing that dialogue is really, really important to us. So really appreciate it. There's some good thoughts here, and I think it's just taking it away and building on it. So thank you.
Great, thank you, Michelle.
Hi everyone. Yeah, I guess just following up on Amy's thank you and Sam's point that we started this a long time ago, and it's so nice to see it now being actually acknowledged at that strategic level and us being able to start to get that thought across the system. It's really welcomed, and I think it will push us on to do more, which will be fantastic, and we don't mind doing more. I just wanted to come back to a couple of points that Sally and Tim mentioned in terms of whether we've engaged GPs and PCNs previously. We do have some engagement from them through the partnership already, mainly from my locality role. So within Poole, and also some of them attended the Hidden Hunger event, and it was really interesting to hear them saying that they do have lots of patients presenting with low level anxiety and stress, and the amount of times that food or the worry about food that is mentioned in those conversations was quite frequent and actually surprised them. So being able to maybe have some of that conversation on some of those bigger platforms that you've mentioned at the CCG membership event and things will be brilliant, because then we can engage some of those wider practices, particularly across the areas of deprivation. Although that said, through the pandemic, and as we've seen with the schools, we've got a lot of engagement from schools that aren't in those areas, that are in areas that were unexpected, where they are experiencing food insecurity. So it would be really good to have that platform to engage that wider level of GP practices and membership across the CCG. So yeah, as soon as we can do that, the better. Thank you. And then just coming back to Debbie's point around the hospitals, we do have some engagement from a workforce perspective, working with some of my colleagues, obviously at Public Health Dorset, and some of the connections there through the pandemic. We were connected in that way, making sure that they had access, that some of the HR teams had access to the food map and were able to support members of staff that might obviously be experiencing food insecurity. But again, to have that on a bigger level across the hospital, and perhaps more some of the senior teams and things will be fantastic. And indeed, looking at your own procurement of food would be wonderful, and I'm more than happy to help with some of that. So it's just, we are starting it, but your support in being able to make that bigger across organisations at a higher level would be really welcomed. So thank you.
Thank you, Michelle. Alistair, would you like to sum up, and then I'll take us back to the recommendations?
Just trying to unmute. Yes, thank you, Chair, and thank you so much, everybody. Wow, this has been a really encouraging session, isn't it? I guess trying to sum up is quite difficult, but there's three or four things that just from what you've been saying that are really helpful. One of them, I think, is your eyes and ears. And Mark, your offer around the 12,500 visits into homes, almost having that in the back of our heads and being able to work with your team so that it's not so much asking the questions, it's a bit of eyes and ears, because one of those things is really hard for people to own up sometimes to the fact that they cannot feed their family. And sometimes just having an inkling, which leads us on then to say, I think we need some really easy roadmaps for people. It's great. The Access to Food Map is just fabulous. But in terms of those, what do I do in 3 easy stages, 3 easy steps? If I'm aware of somebody or I find somebody in particular need, I think that would be helpful. And I think there's something about giving you key messages within your own context that can be used. So we would love the opportunity to talk to some of your teams. I think that would be great. But I think we would love to work with you also to find the ways in which we can make it really relevant for your particular context. And just the final thought was, I think there's some real creativity around Paul mentioning Dorset County Hospital and having a food bank donation point. I wonder whether there are a whole heap of things around maybe some green agendas in terms of people are growing stuff. We've had this idea in the back of our heads, the surplus of this year's harvest. Be great if we could make sure that surplus is getting to people who have so little fresh food maybe into their diets. So hugely thankful, and we'll work on some specifics to follow up with you. So thank you so much, Chair, for the opportunity to come to talk today.
Brilliant. Well, thank you all for imparting so much energy into this meeting. I know the work that you've been doing, and I'm just so pleased to see you share it and to be hearing, because it's progressing each time, isn't it? It started as one thing, and it's getting smarter and broader, and both broader and more focused. And I think the really interesting thing for me is the conversation that we're having about it, the openness that it's okay to talk about food insecurity. It's not a conversation we've always been very good at having, but I think from the partnership that exists within the Health and Wellbeing Board, there are many opportunities for us to take forward together. And I'm so pleased that I think it was probably in the December meeting that as a board we agreed to run our 2 programmes, our 2 themes concurrently. Because there is no doubt that food insecurity is linked to mental health in many cases. There is, feed the body, feed the soul. We can't extract them, and to have dealt with them slightly artificially, I think would have lost the opportunity to be making these connections. And so thank you again for bringing everything forward. And I'm really pleased to everybody who's brought their those genuine offers at a senior and strategic leadership level, and Sam's articulation of us providing more vocal leadership is really helpful. We haven't spoken a lot about children in this discussion, and I think certainly we need to focus our minds on that. I know the work that you do with schools, and we've sort of slightly skated over the impact that adding the Christmas holiday, the half term, and now the Easter, we do have commitment to that funding going forward, but we haven't completed the comms on that. So, but I do think we need to make sure that we always talk about children in this context. Michelle, I want to go to the recommendations. Is it something that needs to be to come in at this point?
I just wanted to come back to Jan's point, because she asked a question about who else in the council we were keen to engage with in terms of teams, and we didn't really cover that. So I just wanted to mention, for me, it's quite crucial just if we can link in with planning and licensing to then just think about that whole healthier environment and the communities that we're building in terms of access to food. So that was and transport, they're the only other ones, Jan. So I just wanted to come back to the point that we missed it.
Great, thank you. So moving to the recommendations that we set ourselves out, I'll deal with A and C for the moment, if I may. I think we've really agreed our approach. I think it's quite iterative, if I can put it that way, but I do hope that you will be feeling the support of the board. In terms of 6 monthly reports back, I hope the board will be content that we keep this as something very crucially on our agenda. Seeing no dissent, I think it's the appropriate time frame, and it is one of our priorities. So I'd like to do that. And unusually, in terms of recommendation B, that we allocate a champion to help drive forward change. This is the point at which the chairman usually looks around looking for willing volunteers or already has somebody in mind. But given that it is quite crucially and centrally engaged in our agenda as a board, I wonder whether board members would be happy for me to take that role on as chair of the board, and to to keep the partnership focus on that.
Yep.
Seeing no dissent, and I would always take the opportunity that a willing volunteer usually gets the job, but I do so very conscious of the significance of the roles that everybody plays around the board, and thanking you all for that, because I think we've all really come together with a load of great ideas, but I cannot wait to see how we feedback and hold ourselves accountable for this over the next 6 months. So thank you very much to Amy, Michelle and Alistair, and that immense partnership which sits behind you. I'm aware of how many people there are engaged, from the people who make those donations as part of their weekly shopping. The impact that has on the people who need this support, and they dip in and out of needing the support as well. And that's something, we're not dealing with a static bunch of people, and it's quite right that the response is flexible. So to express those thanks to you and to everybody else. And with that, if we're all right, we will move on to the next agenda item. Thank you, and thanks for your attendance. And we're back to Sam Crowe now to speak to us about the local outbreak management plan, which has been the framework around which our collective COVID response has been set, and it's now time for an update. So Sam, over to you.
Thank you, Chairman. So good morning, everybody. I haven't prepared a presentation today. There's a cover note which I hope contains most of the main points. This is to do with the refresh of the local outbreak management plans. Just to remind board members, there's a very clear link between the Health Protection Board and the local outbreak management plans, not least because the plan's governed by a Health Protection Board, which works across both council areas, and that's responsible for the response to COVID. But the connection with the Health and Wellbeing Boards is through the Local Outbreak Engagement Board, which we agreed back in the summer would be a subcommittee of the BCP Council Health and Wellbeing Board and the counterpart in Dorset Council, the Dorset Health and Wellbeing Board. And that engagement board meets regularly and leads on the approach to communications and engagement, which, as we learn more and more about the response to the pandemic, is probably one of our most critical interventions. So the draft plan that board members will have seen, hopefully circulated, it is in the process of going through a sort of month-long assurance process. It went to the Regional Assurance Working Group yesterday, and we've had some initial feedback on the plan. It then goes up to national before being signed off at the beginning of April. It sets out how the Health Protection Board work will continue as we continue to mount the response to COVID. If you remember, the original plans were first written back in June 2020, and when we reflected as a team on what was in the original plans, it was clear that the content had moved on considerably based on the fact that there's been a huge shift from national leading the response on COVID to a situation now where it's much more about local delivery, regional coordination of some of the interventions that we need to deliver, and then national support. So because of the fact there have been so many developments, as that responsibility is shifted towards local councils for taking on local outbreak planning, we felt that it was a better idea to write a new plan from scratch and to have more of a feel of a forward look. So the plan supports the National Contain Framework, which is also being reviewed and updated this week, and it continues to make clear that local directors of public health remain responsible for managing local outbreaks to COVID, using a range of powers under the public health and coronavirus legislation. The reason I mention that is because previously, under the sort of statutory responsibilities of the Director of Public Health, we were responsible for assurance around health protection and outbreaks on our local patch. We were never responsible for responding. So that shift has been significant. And at the moment, it's mainly around COVID-19, but I'd also make the board aware that Public Health England is in the process of becoming a new organisation, the National Institute for Health Protection. We're also thinking about how our integrated care system develops over the next year. And so we're in a time of change, and for that reason, the plan focuses quite heavily on the need to keep a local health protection function going, which would be mainly staffed and resourced by the Public Health Dorset team. So we've gone for a single plan this time around under the Dorset Health Protection Board, which covers both unitary councils. Just reflecting on the role of the board over the past few months, it's really been at the heart and the soul of our response. We've had incredible support and incredible engagement through that board to make sure that we're understanding the main threats, to get those situation reports out to the other cells that support the response. And it's been pretty effective as the main accountable body for responding to those outbreaks. In the new plan, we've adopted a format that, as I've said, looks forward. It takes a bit of a different stance. So we're moving on from the defined themes of high-risk settings, intelligence, communications, testing, and contact tracing. What we've tried to do is to put together a plan that's a bit more dynamic. So within it, you'll see a lot more narrative about how the end-to-end outbreak management response should work going forwards. And we've structured that around 4 priorities. The 4 priorities are really about how we prepare to live with COVID-19 safely. And I say that because as the vaccination coverage increases and as more and more people are protected, we're much less likely to see those huge impacts on health and care services. But we will almost certainly still have ongoing outbreaks of COVID-19, which will require a very rapid response. So quick identification, rapid testing, rapid contact tracing, and support to those organisations affected by COVID-19. So the 4 priorities are very much in keeping with that, and they are about keeping transmission low, ensuring that our surveillance around COVID-19 remains optimal, including for new variants of concern, making sure that we've got ongoing effective testing system locally, and increasingly we'll be looking to integrate local contact tracing, working much more closely with NHS Test and Trace. So this is a very, very live development, and under both councils, the teams involved in contact tracing, which started very much as offering welfare calls to people, that has now moved very, very quickly to being able to pull cases directly from the NHS Test and Trace system as soon as they go onto that system. So it's a very, very different situation. And over the next couple of weeks, we'll be moving to a situation where the local contact tracing teams actually handle the bulk of the non-complex COVID cases. And that means we can respond much quicker. We can direct additional testing if we feel that those cases are connected with an important cluster. So it's completely changed the game in terms of how we look at managing and responding to outbreaks by closing the gap in time. So the plan goes through a number of other developments that have changed since that situation in the summer, and we've done a lot of work on deploying rapid asymptomatic testing. So that started with offering asymptomatic testing to employees of both councils and also people working in frontline roles in the community. That's now hugely expanded to cover testing of other important parts of the population. The most recent of which is the testing of household bubbles. So anyone that's got children returning to school are now able to take advantage of rapid testing to make sure that we're making sure those household bubbles are free from COVID-19 and not leading to outbreaks in schools. I've talked about the integration of test and trace. Under the theme of intelligence and surveillance, the public health team have done a lot of work pulling on the national data and building our own local tools to be able to analyse networks and clusters in a much more timely fashion. And we're hoping to start to feed that information in back to the system at 3 levels. So more strategic level information about the types of settings where we're seeing issues, using the information to better direct our tactical response to managing outbreaks. And of course, it's hugely important to our day response team who continue to work on the COVID desk day in, day out, as well as out of hours. As well as the describing the outbreak response, we've also tried to reflect on some of the lessons learned over the past 9 months. I'm very grateful to colleagues from across the system, including both councils, for contributing to that. And a major section deals with how we plan to open up safely under the Prime Minister's roadmap. So that's the sort of main plan in summary. I was just going to sort of reflect that we're just past the anniversary of the first recorded case of COVID-19 in Dorset, which was on the 8th of March 2020. And what we've also tried to capture in the plan is just a sense of the scale of the COVID response. So when we put this together very quickly a week or two ago, we were looking at perhaps 37,000 people having tested positive for COVID-19. And that's just the people who actually were diagnosed. It doesn't account for the people in the first wave who may have caught COVID before widespread community testing. We've sadly acknowledged that we've lost 1,364 people who died within 28 days of a positive test result. We've managed and responded to 365 separate incidents and outbreaks affecting education settings, 588 incidents and outbreaks in our care homes. We've had outbreaks that have continued that have affected all 3 of the major hospitals, and 40 further outbreaks that have affected other healthcare settings. So that just gives you a flavour of the impact that it's had locally. And finally, I was just going to sort of finish up that the plan will be, in a sense, I think, a live development. So as we continue to work through what we think will be important to maintain in support of society locally getting back to normal, we're trying to capture in a live way the ongoing risks and challenges in that plan, but also the mitigations and the opportunities that we feel are important in relation to those risks and challenges. I'll just mention a couple very briefly before opening up for questions. I think what I would see as one of the main risks is the risk of loosening those measures too soon, public fatigue, which is all very understandable, and also the pressing need for all of our organisations to get back to business as usual, because we are storing up some significant issues by having had to focus in major incident mode for so long. So we are trying to provide that assurance that the Health Protection Board will work quietly in the background to maintain a very effective response to COVID and hopefully enable the rest of our partners to devote more time, effort and attention to those other issues which are really, really important but are non-COVID related. I think the other risk that I've talked about in the plan a little bit is the gaps in vaccination coverage potentially. So we've had a great success through the first push, incredible coverage in those older age groups. I think it may be more of a challenge going forwards as we reach down into younger age groups to make sure that we don't have gaps opening up in communities where coverage is much lower. So as long as we have a significant number of people who are still susceptible, then that ongoing transmission is still a possibility. So that's very much what the plan's aiming to address. So I'm happy to pause and take questions. The recommendation really is to note the draft report. It is still open and comment. So through the Health Protection Board, we've asked all members to have a read of the plan and to contribute and to strengthen it where necessary. But I'm very pleased to report that the assurance report we received back from the regional working group yesterday has effectively given it a green tick. They're assured that the main areas that they would expect to see in the plan have been covered comprehensively, and we'll await further comments as it goes forward for national sign-off. So we have until about the last week in March to continue to make comments and amendments. So if partners are interested, if you pick up anything through reading through the draft, please do let us know. We'll do our best to incorporate that in the final version. The final version will be designed as well. What you're seeing today is a very flat document, but we will lift it with some colour and some images. So the final product will hopefully be a really good showcase of that tremendous effort by all of the partners locally. Thanks very much.
Sam, thank you very much for that, setting out the context and reflecting on the past year as well as the present and what the future needs to look like. And also there have been a number of comments, but I think it's the right moment to thank you as Director of Public Health for the leadership that you've shown across the county, but certainly within our experience of at BCP, and our very sincere thanks. And I know you would say it's to the team, so let me say it to you. Thank you. In terms of comments and questions for Sam, there's the invitation to send them on subsequently as well. But Richard, you've got your hand up for now.
Yeah, thank you, Chair. I'd like to echo that, really. I mean, we had an outbreak in our practice and we got tremendous support from colleagues at the CCG and Public Health. Jane Horn in particular was very helpful to us, and I'd like to pass on thanks. I mean, it does seem, Sam, that you've got your work cut out now, possibly even more work for your team to do. And, I was wondering about the resources that you're going to get or otherwise to do this. And I know that you mentioned that you are going to get information directly from Test, Track and Trace. Are you confident that that's going to come through really quickly?
Yeah, thanks. So a couple of questions in there, Richard. And the first about the resourcing issue. National government has actually been fantastically generous in terms of the support that it's given councils. So for all of the time that we were spending under national restrictions, we were given an allocation per head of population that's amounted to a significant non-recurrent sum across both councils. We've used that to pay for our asymptomatic testing programme, but longer term, we're now looking for how we sort of resource our ongoing health protection function within the public health team. So we'll be using that funding over the next 2 years to make sure that we've got enough resilience. The team are very tired. They need to work on some different things just to give them a break psychologically. But we are developing a resourcing plan, and we're confident that we've got the resources to sustain that. Second question about the timeliness. So I believe the national term for this is called Local Zero. I didn't really know what that meant, but apparently it refers to the time from the cases hitting the national test and trace information system and those being visible to local teams. So the underlying platform has changed, and the platform that's now in use means that both of the customer services teams across both councils that work on contact tracing can directly access those cases as soon as they hit the system. So there's going to be a subtle flip around. If you want to know the detail, the model previously was that the cases were thought of in 3 tiers. So tiers 2 and 3 were non-complex cases, which were handled by NHS Test and Trace. And then the top tier of cases was escalated to regional health protection teams. They're normally cases connected with higher risk settings like healthcare settings or care homes or schools. So the local teams won't be managing those complex cases. They still go forward to the regional health protection team, and we still work very closely alongside Public Health England in how we support those organisations. But the local cases, the complex ones, tier 2 and 3, will be pulled directly from the system. And so effectively they'll be pulled as soon as they're on there. So the time should be minimal.
Richard, does that answer everything, or did you want to come back?
No, that's great. Thank you. Really comprehensive answer. Thank you, Sam. In terms of the vaccine, I think you're right. I think that there are going to be some harder to reach groups. And I think as numbers fall, some of the younger age groups as well who feel less vulnerable may be harder to reach. But we will certainly be doing our very best in general practice. Thanks, Sam.
That's great reassurance, Richard. Thank you very much. Tim.
Yeah, thanks. I mean, just echoing really some of the thanks for particularly the public health team that have been, probably had the busiest year ever, really in terms of this and what the team's had to do. And it's been great to see the support right across all of the partners as part of that. Very happy with the 4 principles here. I mean, they seem to make sort of logical sense in terms of the next steps. I have sent it around others within the CCG, so we'll feed back in if there's any other sort of comments from that, and particularly the vaccination. So just one bit I just wanted to sort of check in terms of are you feeling confident enough in terms of, we're likely to see a big increase over the summer in terms of people visiting the area? Have we got good enough sort of connections in with sort of the hotels and hospitality sector? Because it's a lot of people going to want to come, aren't they? It is probably my sort of gut feel on this. I'm sure others are similar on that. So just wanted to check in that, have we got enough in play for that?
Yeah, thanks, Tim. There is a presentation which I chose not to share today, but it's a presentation we've used with the Health Protection Board, which sort of separates out some of the ongoing public health core health protection responsibilities and some of the responsibilities which are probably more in the purview of wider councils. There's an awful lot of effort going into summer operations planning at the moment, and we're also looking at how we use the Contain outbreak management funding to support that where appropriate. So I think the work that we've done alongside regulatory services colleagues, trading standards, have been fantastic in sort of supporting businesses. But you're right, one of the challenges, probably the critical challenge that we've identified as under the roadmap, is that step between step 2 and step 3, when businesses are more open and hospitality starts to open up. I think we are as prepared as we can be. I think we've learnt a lot compared with last year. I think that it feels as if we're in a different place now, and there was a lot of anxiety about the level of visitors that came to the tourist areas last summer. But my understanding is there's still no evidence that we saw any particular rises in infections. I think the risk is probably higher from the travel arrangements, so where people have shared cars or coaches or been on the trains coming down to resorts like Bournemouth or Dorset. It's being in an enclosed indoor space that raises the risk, but we didn't see anything in our local data. I think we're better prepared this time around, and that multi-agency response and conversation carries on, particularly with the LRF partners and the role of the TCG.
Yeah, great.
Thank you, Tim. Was there anything else you wanted to add? Or are you happy with that discussion?
No, that's fine.
Great, thank you, Kate.
Hi, yes, so just really wanted to welcome the engagement that we've had on this on behalf of those other council services, regulatory, enforcement, etc., housing, homelessness, have all got a role to play, and absolutely working together on taking this forwards to keep that focus on minimising risk and harm, as we also need to prepare for the easing of the lockdown, and in response to the points just made, there is very detailed resort management planning happening, and we are looking at some of the risks. So, for example, although we don't necessarily anticipate that we would see an increase in infections, should, for example, we be asked to suddenly take forward surge testing, how would we do that at a time when we are very busy and open for business? So we are working through those things just to give confidence to the Health and Wellbeing Board in a multi-agency context.
That's great, Kate, thank you. There are no other hands up that I can see. Sam, is there anything you wanted to say in conclusion, or just that's it until next time? The work goes on.
Look, the work goes on. I'd just like to thank partners, because we can't do this alone. It has gone on. It's been a very, very extended response. I think the next phase will be interesting, because we are trying to stand down from that sense of this being an ongoing major incident, and that's the spirit the plan's been written in, to allow the Health Protection Board to get on quietly and continue to do the work. But as Kate just mentioned, the challenges just keep coming, and the challenge of responding to surge testing and variants means that we can't do this alone. We have to do this as part of a system, and the response has been amazing. People continue to work through the issues and the challenges and continue to to rise to it. So just very, very grateful for all of that support. Thank you.
Brilliant. Well, thank you for presenting today, and I hope you've taken away our very clear thanks from all the partners as well. So moving on now to agenda item 8, and this is the outcomes and the actions of our development session when we met back in January. And I call upon Kate, if you'd be so kind as to introduce the report. Just that we have a couple of recommendations that perhaps you could talk us through, Kate, as you go through.
Thank you. Really interesting development day held in January on 2 key pieces of strategic work that BCP Council with partners is taking forwards. They form part of what any council framework would have. So I'm sure that people are aware of the local plan, a key document that really sets the spatial vision and plan and framework for development over the medium and long term. And then the housing strategy, which again is a long-term document outlining the commitment that the council has and the shape of its housing vision and plan. So they are strategic, but clearly impact a lot of detail as they go forward. So something that we really wanted to bring to the Health and Wellbeing Board to raise that visibility and to have a chance for partners to feed in at an early stage. So the report before you today summarises the presentation, which is included in the appendix, also some of the key aspects of the discussion which have been fed in and will be taken forwards by the relevant teams leading those pieces of work. In terms of an update, I just wanted to outline that the housing strategy has now gone live last Friday for consultation, which runs until the 21st of May. And then after that consultation, it would be revised and takes on board comments and moves forward for council approval before the summer. So the process, I can make sure that we send out the link for all organisations to follow up and feed in. We'd really appreciate your formal feedback. But also there's an opportunity online for just ideas, photos, great best practice of the sort of types that we've been hearing about earlier today, but as related to housing and homelessness and housing growth and development. So a real chance for your staff and residents and community organisations to get involved as well. So wanted to highlight that. And then in terms of an update on the local plan, the issues and options that were talked about are still being sort of worked through by officers with a view to then later before the summer going out for a consultation that again will be a wider public opportunity for partners and the public to feed in. So I think the summary of the discussion was really cross-cutting. I think we really pulled a lot of the threads between issues around housing, issues around obviously health and the role of the planning system in thinking about the way that we can support communities and their health outcomes, looking at environmental issues as well, access to green space and how we have the right infrastructure for healthy communities going forward. So it was a very lively, engaging development session. And I guess I would just ask that partners really continue their engagement with the process. So in terms of the recommendations, it is that the board notes and approves the summary of the outcomes from the development session, and that you consider and agree the actions detailed for inclusion in the board's forward plan. So again, that's about an ongoing consultation process that we can facilitate through the board. But I would also ask that the partners do, take this back to your organisations to make sure that they feed into the process as well.
Kate, thank you very much. It was indeed a very engaging development session on two quite separate issues, but actually the linkages between them were all around health and wellbeing, weren't they? I have nobody indicating with questions or comments, which rather makes perfect sense given that you were feeding back from a session that many of us attended. So thank you for that, and I think we will now move on. But just to note about those live consultations, so it brings us rather nicely actually to the forward plan, because it is about considering how the board is now going to organise its work. So I'd just like to report that the forward plan is being developed, and it will be done so to ensure the implementation of the health and wellbeing strategy, and also ensure that the board fulfils its role in relation to overseeing the local outbreak management planning in relation to the pandemic. And I think that's been very clearly set out from Sam, that we can expect some quite regular updates from that, and also some deeper dives where we need to do so. I would also, I presume everybody's got had sight of the forward plan if you don't currently have it in front of you. There is an additional item or two that I'd just like to bring to members' attention, and that is around deprivation, which is one of those things that we have said we would like to focus on. And this has come from Kelly Ansell, and what it will do is it'll enable the board to monitor the empowering communities priority that we set ourselves to promote the agenda of tackling health inequalities. Kelly Ansell has requested that that be included on the forward plan for our meeting in June. And it's proposed to start to set out a clear roadmap for the work of the board, so the timing would suit rather well. It'll also bring together the considerations of the ABCD work, which was touched on earlier on by both the Access to Food Network and Councillor Jane Kelly, along with the deprivation work. So that'll be a really good time to reconsider recovery actually in our communities, rather than just looking, as Sam was saying, we need to move from just the major incident sort of approach through into recovery, and that we would therefore keep our development session in September. And so we can focus that on refining and developing the structure, so that we bring our minds to developing a coherent structure really around the board's work on inequalities and deprivation. With that in mind, do board members have anything else that they would like to consider? Oh, I'm so sorry, I do have another one, which is that Paul Eagledon has asked if he could invite someone from the Health Foundation to give us a presentation on anchor institutions at the board meeting in June. I think that'd be quite an interesting counterpoint to ABCD, actually. So with that in mind, would anybody like to raise issues for the forward plan? Debbie.
So thank you. So just wanted, I mean, it looks a really exciting agenda, and and I'm looking forward to all of the items that we're going to be looking at are interesting, relevant, and really important, and around great opportunities for working together on improving health and well-being. I just raised the question really about what is it that the board would want from your acute partner, or acute partners, but there were things that were going through my mind, which is that I can come to all of these sessions and be thinking about what's our role, what's our connection, how do we fit in with this, and I'm really, really happy to do that. There's something else, and you've just said it there, the focus, I think, on the anchor institutions will be really, really important for us to be building on, and so what does that mean, particularly, for us as one of the larger organisations. But I just left it as a question to not necessarily respond to. I'm not pushing to make a presentation or lead a discussion or anything like that, but I am very mindful that the transformation of our acute services locally and our connection with the community and primary care, all of that issue is really important to local people, and it could be very disruptive. It can be very disruptive in terms of achieving better health outcomes, or it could be really brilliant. And I think a lot of people are worried about it. So I've just wanted to flag with that big change agenda, what is it that what is the lens that the Health and Wellbeing Board would want to come at that on? Because obviously there's the role of scrutiny committee in areas, then we have our relationship with the wider council in areas. There's all sorts of overlaps, but I'm really keen to carve out that sweet spot, which is us. And I'll just ask people to think about that and perhaps reflect on that. And equally, I'm very, very happy to come along and listen and join in and contribute and be stimulated and think through what implications are. So I'm not pushing to say something, but I do think it's important to ask that question at some point.
Yeah, that's really really helpful and perfectly fair, Debbie, that it needs to be relevant for board members, but for our communities as well. Sally.
Thank you. I did put my hand down because I see Jan's put her hand up, and I'm not sure whether we're going to say the same thing. Jan and I have had some communication this week around whether or not it would be helpful to link with the corporate office in terms of timeliness on the forward plan to have an update around the implementation of the dementia review. There's some significant improvements that are being implemented now in partnership with Dorset Healthcare as the main provider and a third sector provider as well. So it may be timely if we think through when in the forward plan it would be good to bring back some progress on that if the board would like that.
I'd certainly support that, and Councillor Karen Rampton has raised that issue as well. But Jan, did you want to speak to that and to the other points?
Yes, I think that would be very timely, and we might want to just ensure as a board we're looking more widely as well in terms of the dementia review services, but also more widely in terms of our aspirations for dementia-friendly communities as well, which has been somewhat inhibited in COVID, but we need to now think about how do we really drive that forward as partners. I wanted to come back just on Debbie's question to us. When we've set out the strategy, I think we're saying that what we as a board wanted to do was to ensure as working across partnerships that the major changes in our health services configurations really did improve well-being and health. So I think there is something in terms of the board, in terms of understanding the progress of those changes and really holding ourselves to account as partners, as well as the trust itself, that those major changes are delivering improved health and well-being outcomes. So I think at some point we will want to come back to that, Debbie, with that lens, I think.
Thank you, Jan. Sam.
Thank you. Yeah, it's just building on Jan's point, really, and in answer to Debbie's question, I think there are huge opportunities through the HIP2 programme. You think of all that capital coming in for the renovation and improvement of our hospitals. I think one of the questions is, if you look at the, I don't want to preempt the presentation on anchor institutions, but there's something about challenging ourselves as public sector leaders. Are we making enough of devices like the Social Value Act, for example, to make sure that the benefits of some of that investment are maybe being felt in some communities more than others, particularly where there are those gaps and there are those differences in health outcomes. So I think there are several different ways that we could look at that, and it's a good challenge, Debbie. Thank you.
Thank you, Sam. I think as well we will need to be mindful of the agenda of the Health and Adult Social Care Overview and Scrutiny Panel, and perhaps do some work with I'm happy to work with the chair there too, so that we don't ask for the same thing, and because there's no point you doing the same presentation to the same group of people more than once, although clearly there are, there's a lot of overlap of work, so I'm happy to work with the chair on that. Debbie.
Yeah, thank you. Just to quickly say also, I mean, everything we're doing is absolutely rooted and connected with changes with the community and primary care and improving health. So our bit of it is one end, but I absolutely would want to be doing that in conjunction with Eugene and others. So,
well, it's just, wouldn't it be great if the outcome of one of those meetings was essentially something that everybody understood about this is what the hospital are doing, and this is how this impacts on to our communities so that we can draw the lines from one to another. And I wouldn't begin to suggest mapping such things are easy, but actually if we can't communicate it, then are we properly doing it? So, you know, it is a challenge that we have to ourselves to make sure that we make sense of that. But yes, I suppose it will help perhaps to do a bit of further work on the forward plan and come back to members of the board so they can see the development of the direction of that meeting in case anybody wants to add anything to it. I have no further comments. I've been advised of no further business and I've got to the bottom of my agenda. And I don't think I've skipped a page along the way. Can I thank you all for your contributions? It's been a really engaging meeting and I'm very grateful to everybody who's contributed, both the presenters but members of the board who represent large numbers of people who are, you know, absolutely on a daily basis engaged in delivering improved outcomes to our communities. So thank you all very much. We have a development session coming up, date to be determined. We have another board meeting in June, and in the meantime, keep safe everybody, and I look forward to seeing you soon, some of you this afternoon in another meeting. Goodbye.
Thank you.